Hello everybody, and welcome back to a brand new episode of Contract Codes. In this video, we will discuss the federal budget for the 2020 fiscal year. We'll touch on specifics as well as the effects that the COVID-19 virus had on the budget and the country. The United States faced significant challenges, both in terms of public health and the economy, demanding a swift and comprehensive response from the government. Let's explore the specific allocation of funds to various agencies, how it impacted different segments of the population, and how it compares to the previous year's spending. In the 2020 fiscal year, the federal budget amounted to a staggering $1.6 trillion. Let's take a look at some key agencies that received substantial funding. The Department of Defense continued to be a major recipient of federal funds, spending over $714 billion and ensuring the nation's security and enhancing military capabilities. If you are starting to see a trend in federal spending, that is because the United States government spends close to 50% of the federal budget on defense, more than the next 10 countries combined. Meanwhile, the Department of Health and Human Services, HHS, spent around $178 billion. The HSS played a pivotal role in combating the pandemic. Agencies like the Centers for Disease Control and Prevention, CDC, and the National Institutes of Health, NIH, received increased funding for critical research, vaccine development, and public health initiatives. As the pandemic wreaked havoc on businesses, the Small Business Administration, SBA, received heightened funding to support struggling enterprises through loans and grants, helping to preserve jobs and stimulate the economy. An estimated $390 billion was spent in funds to support struggling small businesses during the pandemic. The COVID-19 pandemic presented unforeseen challenges, impacting federal spending in various ways. Healthcare and research saw an exponential rise in funding as the government ramped up efforts to increase testing, develop vaccines, and bolster healthcare infrastructure. To alleviate financial hardships, the government introduced multiple economic stimulus packages, providing direct payments to individuals, extending unemployment benefits, and offering financial aid to struggling businesses. An estimated $814 billion was spent on struggling households during the pandemic for the stimulus package. The pandemic highlighted the importance of social welfare programs. Increased funds were directed towards Medicaid and housing assistance to support vulnerable populations disproportionately affected by the crisis. With widespread job losses, labor agencies experienced an unprecedented demand for unemployment benefits and workforce development programs. Now, let's compare the 2020 spending with the previous year. The 2019 fiscal year budget was relatively moderate, as the economy was stable without any major crises. However, the pandemic led to an unparalleled increase in spending in 2020 to address the urgent challenges faced by the nation. This caused a great shift among small businesses. Those that could adapt moved to remote work and barely stayed afloat, while other businesses could not keep up with the effects of a closed economy. The federal budget for the 2020 fiscal year was a reflection of the government's commitment to addressing the COVID-19 pandemic head-on. The response included significant investments in healthcare, economic recovery, and social welfare programs aimed at protecting public health and supporting those most affected by the crisis. As we move forward, this extraordinary experience emphasizes the importance of strategic planning and adaptability in tackling unforeseen challenges. Thanks for joining us today. If you found this video informative, don't forget to hit that subscribe button and give it a thumbs up. Stay tuned for more intriguing topics and remember to stay informed. Until next time, business leaders.